Demand for urgent and emergency care is rising. Currently, most patients go to the A&E department of their local hospital, but this isn't necessarily the best place for them. Those with minor conditions, the walking wounded, can often use other services such as NHS walk-in centres or NHS Direct, while people with very serious conditions are often better off going to specialist centres. It is now accepted that to treat stroke patients successfully, specialists have a limited time window to give them the correct treatment. At Oxford, we talked to a lady who received such treatment.
I was in my daughter's car, and then I just felt my arm go numb. I couldn't move it. Then I noticed my leg wouldn't move, and then I couldn't move my head either. They got me out of the car, got me in the ambulance. I had the two tones going up the A40. I went through to the A&E, and the stroke people were there ready to treat me, the specialist doctors.
If we see the patients within an hour or two, we can get a scan straight away, we can do something about it. We can get the very best people always accessible, and you can't do that in lots and lots of places. You have to do it in places where you concentrate the activity.
Now I was getting things put on me to monitor me.
And it's worth the extra few minutes to get to the right place. You need to go to where you need to go to get the very best care. That's not always the local hospital.
I felt my foot move, and then I could feel the feeling coming back in my leg and obviously my arm, and then I could speak again within probably maybe an hour. I went in on the Tuesday afternoon when it happened, and I came out on the Friday lunchtime.
So there's 100,000 strokes a year in England in the NHS. You know, if we could get 50 hospitals working like this, we'd be preventing maybe 200 or 300 bad outcomes every week, and that would make a huge impact on what happens with stroke in this country. And the way we do that is by organising care and working as a team, making what needs to be made available at the front door 24 hours a day.
If someone had said to me, "You've had a stroke in August," I wouldn't believe them, if you know what I mean, because I don't feel like any different to what I did before I had the stroke. I feel absolutely back to normal.
Not every patient needs to be taken to hospital after an accident or in an emergency. Today's ambulance crews are more specialised than in the past. Some, like this one in Leeds, are taking an innovative approach to treating patients at the scene.
I am an emergency medical technician for the ambulance service. I work on accident emergency ambulances normally. And what we've done here is develop a bicycle which is capable of doing exactly the same role in the city centre of Leeds. We respond to approximately 4 or 5 jobs a day. On a busy day, I think our busiest day was 14 emergencies. The advantages of bicycles are that they can get around quicker through pedestrianised areas, through back streets, all kinds of areas that vehicles can't access very easily. And we can also, with the bicycle, take all the equipment needed to treat people right next to the patient's side. If we can't do that, we can also offer advice of where it's appropriate for them to go, and it might not be necessary for them to go to A&E. Also, we get to know a lot of the people that live on the street, and we're in constant contact with them, and we can keep an eye on them and treat their minor injuries and just be around for them. On the top here we have an entonox cylinder for pain relief. We have an observations bag. In here is all the equipment we need to take basic observations on patients when we arrive. A big first aid kit, a mini oxygen cylinder and some burn shields. We carry a suction unit, airway management equipment and a defibrillator. We can cover pretty much anything from a cut finger to a cardiac arrest and all the bits in between. The whole concept has been really taken on by a lot of the ambulance services. I've helped a couple of services set up their ambulance bikes in large urban areas with big city centres. They are proving worth time and time again. Compared to running a rapid response vehicle, it's a fraction of the cost, and with an enthusiastic staff maintaining the bikes and looking after the kit, it certainly is affordable by any service. 10 hours a day, you know, 3 days a week, 4 days a week, it keeps you on, yeah, fit or knackered.
When you have a minor injury, it can be more convenient to go to treatment without having to go to the A&E department. At Tiverton Community Hospital, doctors and nurses work closely together to treat minor injuries in the local community.
This is Tiverton Hospital in Devon. It's a minor injury unit and we see about 15,000 patients a year. It's open 24 hours a day, 7 days a week, and it's run by nurses but overseen by doctors. Jamie.
Hi, I'm Val.
We'll pop into room 3. Everybody who works here has to do certain courses, and I'm actually just finishing the nurse practitioner course, which is a 2-year degree course, which enables me to do a little bit more advanced nursing. I really enjoy it, actually. Really enjoy it. I just want you to do a few movements with me, really.
All the GPs are experienced in working in the minor injuries unit, so when a doctor comes who's called, he's actually been doing this for about 15 years. So it's a very experienced person that you get to see here, who can make a decision about whether the patient can stay in Tiverton or has to go be referred on.
Ever injured that wrist before?
No.
Never?
No,
okay,
first time.
all right then. Right, we'll have a little look at this wrist.
It's provided a really good local service.
How about along here, Jamie?
It hurts there.
If this unit wasn't here, they would have to travel 15 to 70 miles to a district general hospital. That would be either Taunton or Exeter, and go to a major A&E department.
And they can also be followed up here, which is also very important because that may be 3 or 4 occasions. If patients come in with a major problem, we're quite lucky here because we've got the nurses who can triage them. They can call doctors with multiple skills who can stabilise them and get them transferred urgently via the ambulance to Exeter. I run a fracture clinic which is once a week, and I see between 20 and 35 patients. You've got a fracture of the scaphoid, it's a little bone just in here, and this can sometimes cause quite a problem.
Yeah.
And you have to be in a plaster, special plaster, and you have to be in it for 8 weeks.
Okay.
The fracture clinic takes the pressure off the fracture clinic in Exeter, and I don't know if you've ever been to a fracture clinic, but it's always a real bum fight.
The Kent Air Ambulance Service helicopter flies an average of 3 sorties a day, providing specialist trauma treatment and a swift journey to the clinically appropriate destination.
Kent Air Ambulance is an independent charity. We work with the NHS, so the pilots are provided by the charity. The doctors are actually funded by the charity. The paramedics are seconded to us from the NHS Ambulance Trust. So we've got a mix of teams coming from 3 completely different backgrounds, 3 different employers.
Radio check, now clear at 1458. Roger, just started up, shortly airborne. Can you take what's secure?
We provide a service to get a paramedic and a physician, a doctor, to the scene of an incident quickly, and then to take the patient to the nearest hospital that's appropriate for their need.
Can we get more details on the job, Al? This is a single car RTC overturned, 1 patient reported trapped over.
I was stationary in a queue of traffic. A lorry lost control behind me and fell on top of my car, crushing the car and me in the process. And that was when I needed the help of the air ambulance to get to hospital as quickly as possible.
It's not always the case that the patient needs to go to the nearest accident and emergency department. What we try and do a little bit differently is take them to the specialist hospital. So if it's a head injury, we'll go to a head injuries unit and so on.
They arrived within, I believe, a quarter of an hour. Paramedics treated me on the scene, as did the doctor. And then I was whisked away, and it only took 5 minutes to get to the hospital.
Landing mode at 1503.
It does improve their chances if they're seen by the right specialist as soon as possible, rather than going via a district general hospital and then being referred on. That's where we believe we actually make the difference.
It was definitely worth the extra journey, absolutely.